It is both an honor and a privilege to address you today at this historical significant event, the launch of two landmark documents, the report on the analysis of Sri Lanka's policy on healthcare delivery for universal health coverage, and the guidelines for gender mainstreaming in health policies. Today marks an important milestone in our journey towards ensuring equitable, inclusive, and sustainable healthcare for all Sri Lankans. I noticed that Sri Lanka's UHC service coverage index currently stands at 67, which is above the average for South Asia. However, countries such as Malaysia and Singapore, as you have seen, reported markedly higher values than Sri Lanka. So, we have a long way to go. This is because a few sub-indicators remain low in our country. These include low TB treatment success rates, suboptimal screening and management of hypertension, limited care seeking for respiratory illness in children, and lapses in health workforce density. Improving these indicators alone will move Sri Lanka's UHC service coverage index considerably. This is why our new reforms in primary health care are so vital. We are establishing primary health centers that will serve population groups of around 5,000 to 10,000 people within a 2 to 3 kilometer radius. This is the main priority of the government for the health sector. These units are designed to increase accessibility, reduce out-of-pocket expenditure, and ensure continuity of care within a people-centered model. They will be fully integrated into the shared care cluster system, ensuring a seamless referral mechanism between primary, secondary, and tertiary care. The government is fully committed to this process, and the Ministry of Health thoroughly analyzes and implements the process. I am confident that these proposed primary healthcare reforms will elevate the UHC service coverage index to the next level. Alongside these reforms, today we also launched the guideline for gender mainstreaming in health policies, the first of its kind in our country. Until now, Sri Lanka lacked a structured framework to integrate gender considerations into health policy. This guideline is designed to fill that gap. It provides health policymakers with practical tools and direction to ensure that all health policies are either gender responsive or gender transformative. It recognizes the profound influence gender has on access to health care, exposure to risks, and health outcomes. Importantly, it equips health managers with the skills and knowledge to address these inequalities proactively. These guidelines offer practical, evidence-based tools to embed gender considerations across all levels of health policy, from planning to budgeting to implementation and evaluation. Gender mainstreaming is not just a technical requirement, it's a moral and developmental imperative. Gender mainstreaming is not an abstract principle, it is a necessary strategy to institutionalize equity. I am sure this document ensures that our policies reflect the realities and needs of all individuals, regardless of gender or background. A gender-sensitive health system is a stronger health system. It is one that recognizes and addresses the real needs of real people. I would like to take this opportunity to express my deepest appreciation to all the stakeholders, government officials, researchers, healthcare workers, civil society organizations, and development partners who contributed to these documents. Your collective efforts embody the spirit of collaboration that is essential for health system transformation. As a Minister of Health, I give my firm commitment that these documents will be integrated into our policies, inform our reforms, and shape our decisions moving forward. Let us remember that achieving universal health coverage is not just about systems and structures, it is about dignity, equity, and the right of every Sri Lanka to lead a healthy and fulfilling life. In closing, I call upon all of us here today, policymakers, practitioners, partners, and citizens to take this work forward. Let us ensure that every step we take brings us closer to a health system that leaves no one behind. Thank you, and may we move ahead with courage, compassion, and conviction. And I would like to express my sincere gratitude to Dr. Said also, to a comprehensive keynote speech, and I highly appreciate again your support, dedication for all the healthcare workers whom work tirelessly for the past decades to gain this success. But we have difficulties and we are facing the shortcomings and gaps. I think in next 3 years, as a team of the health ministry, we can achieve this goal and set a high standard to our region. Thank you very much.